This guy's going a little nuts, crazy, but it's okay. He likes sweat.
It's just happy to be here.
He is happy to be here, and if you sweat, he's just gonna keep licking your leg. It's the salt
incessantly.
We all have dogs. Anybody else?
Yeah,
same thing.
Yep.
They need their electrolytes.
Are you just saying that to make me feel better about Murph?
No, absolutely not. Stevie goes absolutely bananas as well.
Does she?
Mm-hmm.
It's wild.
You have to. We're not putting electrolytes in their water.
That's a good point.
This is my only chance.
Mm-hmm. Every now and again, I feel like debating on as to what type of food I want to give her as well. You ever see those that are going around like, God, do I really want to give her the kibble? Dang it, I should probably do a high quality product right now. Maybe I need to start thinking about electrolytes too in her water. Really should.
Yeah.
Important dog ownership cue.
Well, Murph is allergic to chicken slightly, as we found out.
Oh, really?
So he gets the fancy boy sensitive stomachs salmon
wow.
food. Yeah.
It makes sense why you want to get him a suit now, because you can only eat salmon dog food.
It's not for him, it's for me. That was misleading post that I made. And hello, everybody, and welcome to the Average Bros Gym podcast with your hosts with eerily similar names, Croy and Corey. Sit down and talk about life advice with no polarizing black and white takes, just genuine advice and good conversation. Maggie, I don't know if you've listened to any of these episodes, but every time I do the intro, I don't remember what it is.
Oh.
Yeah. So sometimes I have it on my phone, and sometimes I'm looking at it, but other times I'm like, you know what? This is the episode. This is what we're going to talk about, and the listeners are going to like it. So
I like it.
Perfect.
Just wing it.
Without further ado, you might have noticed we have someone else with us, and not just Murph. Maggie Koethe. Koethe?
You did pronounce it right.
Yeah.
That was good. There we go.
Maggie Koethe. So Maggie does chiro work. She does like kind of PT rehab work. She is a coach at Orange Theory as well. She's done pretty much everything in the world.
Oh yeah, I do it all. Everything.
You're like, I don't know if are you a runner? Do you classify yourself as a runner?
I guess. I used to not, but I think I've run enough races at this point that I have to classify myself as a runner. I've ran more than 2 races this year.
Okay.
And I'm going to run another and a 4th.
So you don't have, and we don't believe in labels. So you can be whatever you want.
I mean, I like to say like I run.
Sure.
But am I a runner? Maybe.
Okay. I like
Maybe time will tell. I don't know.
I like, Corey, do you classify yourself as a runner?
Oh, I think everyone's a runner, on the inside. You always hear that afterwards.
Christ.
Like once they start, it's like, I never thought of myself as a runner. But then once I started training.
That was the most Average Bros Gym podcast response you've ever
Everyone's
had.
a runner.
Yeah. Everyone's a runner.
Run 10 feet, you are a runner.
I love it.
I wonder what the average distance would be if someone was in a life and death scenario, like we were talking about, maybe in long legs, and you're trying to run away from a serial killer or something like that. How far do you think you could go? The average person, 3 miles?
How long legs do you have?
Yeah.
Nice. Oh, there it is.
That's a factor.
Hey,
That's a
what
factor.
wasn't like, hold up. We're going to get into some real pseudoscience shit here real quick. Isn't one of the benefits of like being human as far as like evolutionary tree goes, like our endurance running capabilities?
Yeah.
Okay.
Like we should be able to run pretty far.
Mm-hmm.
I don't know how far that is. And I think it would depend on like getting really deep into it, what type of muscle fibers you have.
Oh, okay.
So like fast twitch, slow twitch.
Mm-hmm. Like what's predominant, like, type 1, type 2A, type 2X, as some people call it.
Mm-hmm.
Okay, we're getting fancy here.
But who knows when you are in like a fight or flight situation? Like you can probably do anything at that point. Your body's just running off adrenaline.
Mm-hmm.
So if you're in enough fear, you could probably run as long as you needed to until you died. I don't know.
Well, and that's just in that life or death dire situation. And then you can also see, just as it's on the grand stage that we're all watching right now with the Olympics, like what can you also want, or what do you want to train for, and watching the 100-meter dash, which is going to be exhilarating come this weekend if you're watching the Olympics. And if you're not, why are you not? It's awesome. Or being able to run a marathon ultra,
Yeah, it's wild to see what people can do.
What races were you doing previously, or which one are you currently training for? Because you said you have done 2 and then you are doing another one this calendar year.
I did a 10K in April. I did the hot chocolate run. And then I paced a friend for a half marathon in May. And that was awesome. But I want to do my own half marathon. So that's what I'm doing September, the first weekend of September. And then I will probably do a half marathon turkey trot Thanksgiving.
Ooh, okay.
So that's the plan. We'll see if I stick to it.
Now,
who knows?
This the first year that you considered yourself a runner, or have you ran?
No,
previously?
I've ran a marathon.
Oh, let's go. Okay, which one?
I ran Grandma's Marathon in 2022.
Nice.
And then it just wrecked my body. So I took a couple years off, really focused on strength training and a little bit of rehab because I did sprain my ankle in the middle of training for that marathon. And so I kept running on it, of course, because why wouldn't I? Finished the race and then just had to recover from that. So then took a year off of racing, and this year I'm back.
So let me ask you a question then. So that's interesting perspective. So you said, okay, you did this race, 2022 Grandma's Marathon, and it wrecked your body. Talk to us about kind of how you like perceive, like what happened.
I mean, I would say I was probably overtraining a little bit. I probably wasn't fueling correctly and eating enough before my races, during my races. I probably wasn't doing the best cross training or rehab during training to make my body feel the best. And I mean, I sprained my ankle in the middle of training. So it was right in the middle. And like, you can do anything on a sprained ankle if you can tolerate it. And it wasn't that bad of a sprain, but it definitely made a difference. So then I was having all these different compensations within my gait and within how I was running and just general form. And it just kind of wore down, and I finished the race and I was like, my body has never hurt this bad. And it probably would have been in that much pain anyways, but then it just kept lasting and lasting. And any run I would do, it just continued to feel worse. So kind of had to take a step back, slow down my paces. I wasn't not running at all. But I wasn't running more than 3 miles for a little bit.
Wow. So like how long were you only doing those 3 miles leading up to the actual marathon?
Well, leading up to the marathon, I did the full training.
Oh, sure.
It was after the marathon that I was like, okay, we got to scale back. Before the marathon, I was full send. Like, we're going to do this marathon. We're going to finish it. We're going to train the way my training plan says I need to. And I just kept doing it. And I was rehabbing the ankle. Like, I was doing stability work and doing all the things that you should be doing. But I mean, it was still a sprained ankle that I was still running double-digit miles on every single weekend.
Sure.
So
Go ahead.
And you said that was halfway through your training program.
Yep.
That you tweaked the ankle and then proceeded to stick right with the training program that you said you were going to do.
Oh, yeah.
At the beginning. And I would love to hear a little bit of how you differentiate, and as all athletes, here in the room, how you go about assessing that.
Thanks for saying I was an athlete, buddy.
Dude, everyone's an athlete on the inside. We all.
Everyone is an athlete.
But you hear it's like, oh, I actually need to take some time to recover. I actually need to take the time to get my ankle better and then, reassess down the road, or versus being able to have that kind of mentality of like, okay, I can still push through this. It's not going to be comfortable, but I can get it done.
I mean, it definitely depends who you are. I was in school at the time, so I was still getting free care from other providers too. So I knew I could get treatment on my ankle every single week, if not twice a week, to make sure that it was feeling good at least. And I like to do things where, and I tell my patients this a lot too, that if your pain level is less than a 4 out of 10, you can probably power through and make it worse, because that's not a level of pain where your body's going to start locking up and feeling panicked. That's more of like, this is really uncomfortable, but I can make it work. So as long as my pain threshold was under a 4 out of 10, roughly, I would just continue to do something, which is not a rule for everyone. But that is the rule I have for myself. And during rehab, that's the rule I give to people, just a rough guideline on toleration and how you can push through things, because not everything's going to be comfortable. And it's okay to push ourselves into that uncomfortable zone, but we need to know what is too much discomfort. So that's how I kind of took it.
Sure.
I love hearing that.
What do you think then? So like, so you talked about kind of your rehab and kind of getting essentially like work done. So tell us about kind of like what you do, I guess, kind of what about Nordic rehab, right?
Yeah. Nordic Rehab and Chiropractic. So I'm a chiropractor by trade. I am also a certified personal trainer. I practice in Excelsior, Minnesota. I'm within another practice, so I rent my room. So it looks like on the outside that I work with or for Minnesota Movement, but I'm really just my own owner of my own practice, and I rent my space and I rent their area. And then I also get to kind of piggyback onto their marketing, which is super cool. It's a really collaborative space, but that's where it kind of gets confusing for people. So I like to clarify on that. But I was I don't know where you want me to start, but I'll start from the beginning.
Start wherever you want to start. This is
Absolutely
your guest show.
It's hard to like explain how I got to where I am and why I practice the way I do without explaining what kind of chiropractic looked like growing up and how I got into it. So a lot of people hear chiropractor and they'll have very polarizing opinions on it. Some people love chiropractors. Some people think they're the quackiest people ever, which some of them might be, and that's fine. But there's
everything in between.
Like, we've got it all, which is great. You never know what you're going to get. Just kidding. But a lot of chiropractors, typically, the majority will, I guess, just adjust people and then send them on their way. It's a 5-minute appointment. You're getting those adjustments. You're getting cracked, as you would probably see on social media. That's the big one.
What do you think? Yeah, what do you think of all those social media memes where it's like the chiropractor has like the plywood and they're just like,
it's hilarious. That's what it looks like. Like that's how chiropractors are being presented in the media, which is fine. We do like adjustments are a big part of chiropractic, but there is a lot more. The scope is really large. So I was an athlete and I saw chiropractor growing up and it was great, except it was great until it wasn't because it only did so much. The adjustments only got me so far, and adjustments are really good at getting pain levels down, but then you grow dependent on them. And I was like, okay, how can we get the benefits of this, but also find the power to be able to help feel better on our own? And then that kind of comes in the rehab scope of things. So kind of taking some things from physical therapy and taking things from massage therapy, like making people feel better and then giving them the tools so that at home they can strengthen themselves back up, get back to their activities quicker, and ideally get out of my office.
Right.
Mm-hmm.
So that's kind of how I found my way there. Is I was a frustrated athlete who wasn't getting better and didn't have the answers, and kind of had to learn from all these different providers and see so many providers when really the scope of chiropractic allows you to do all of that in one space. So why aren't we doing that? So that I found some sports chiropractors who practice similarly to me, and I learned from them and tried to find the best way to do it that I think, and that made sense to me. And that's kind of where I found myself doing a lot more rehab and muscle work.
Mm-hmm. Well, I think one thing that you said in there really resonated with me is the fact that you wanted to get people in, treat them accordingly, and then get them out of your office, like in providing them tools to be able to become self-sufficient and independent. Like, we all work in a space where ideally we're trying to work ourselves in a way out of a job.
Yep.
Like I want for you to be able to succeed out of my office versus somebody who, and I think this is where the maybe misconception is, or the perception of chiropractic is potentially the Band-Aid that gets placed over. You might hear this all the time. And then, not actually getting down to the root cause, which is what you were, detailing out there, which I love to be able to hear.
Yeah. I think that's the big thing is like you'll hear about people who see their chiropractor every single week and they have their standing appointment weekly every single time. And that's fine. And that is awesome. And some people really love that.
Mm-hmm.
But I know a lot of people who don't want to be doing that and a lot of people who don't want to. And so if I'm doing my job in the way that I want to be doing it, I'll get you out of my office as soon as we possibly can, depending on the injury. It's going to depend person to person. And then hopefully, like maybe you'll want to come in every 8 weeks and like do a little tune up. Like I'm working out every week. It feels great to have someone do a little bit of muscle work on my glutes, especially as I'm training for a race. And a lot of the people I see are training for things or just athletes and working out pretty often. So that is something that they do desire. But if someone comes in with an injury and they want to get out and never see me again, once it's healed, that's fine. And it's like, then hopefully in the future, you'll probably get injured again. The odds are that you're probably going to get hurt sometime for the rest of some point during the rest of your life. I hope they would come back and see me because I was able to help them get to that point where they felt better.
Yeah. And we all talk about like, if you're looking at two different perspectives, it's like, I could be sedentary in my life and run the risk of all these things happening to me, or be active for my entire life and run the risk of other things happening to me. I'd rather have these injuries from being active because the net gain is so much higher than like having an issue where it's like, okay, well, I've been sedentary sitting on a couch, right? Like you said, like your goal is people out of the office, but like they will get injured again.
Yep.
That's how life works. If you're pushing yourself to a level, like you're going to get injured, but your goal is to mitigate those injuries and then make sure that you have the right tools to then like they can leave knowing that, hey, now I know some exercises that I can do for XYZ. My ankle is feeling better because I can do these exercises on my own, but every once in a while they'll come back and see you, or they want to tune up or something like that, right?
Yeah, exactly. That's kind of the goal, I guess, which a lot of people do it differently. And you could walk into 10 chiropractic offices and those 10 chiropractors are doing something completely different than the other one. So it's important as like a patient to do your research and find out who you're going to see, which is why we offer a lot of the docs in my office. We offer a 10-minute phone call, like completely free. Give us a call. Let's chat. Let's see if we're actually a good fit before you commit.
Yeah. I remember I was recommended to you by Anna, of course. And then, it was for me, I think I first went to see you because of my knee/ankle. I believe. I could be wrong.
I think so.
Yeah.
That sounds right.
Sounds right. Yeah. So I've got, you see a lot of people. But yes, I mean, like I had my knee injury for a long time, which prevented me from doing a lot of like high impact movements. Olympic weightlifter back in the day, but like the knee pain was just too much to even like any split jerk, anything like that was just out of the ordinary, out of the picture. And I had rolled my ankle several times, right, over the span of doing dumb shit as one does,
as we do.
But yeah, so and like I remember seeing you, and it was like, okay, cool. Well, I went to you specifically because Anna had said, okay, well, she does a lot of like exercise work, right? A lot of work kind of gets you back to where you want to be and give you the tools to help you kind of do that. And so I've been doing ankle exercises, doing the knee work and stuff like that. And that pain has greatly improved. And so I'll see you every now and then, but it's like,
yeah. I mean, that's the goal. I would like to see my patients less and less, which is a great business model. I mean, when you're starting out, it is a really hard business model to have though, because I do want to see people getting better, but it's like, okay, I'm still building a business. How do I keep people coming in? So then at that point, it's just word of mouth and like making sure that people are getting the results that they want. So hopefully they want to share that with other people.
Right. The referrals. And again, they're going to get injured again. Like, my knee and my ankle are feeling better, but yeah, my neck is still fucked. So, I mean, I guess it's every single time. So There you go.
Now, it sounds like you knew fairly early on that this was a path for you, I think from like a career standpoint. Is that fair to say?
Somewhat. I decided I was going to go to chiropractic school my senior year of college.
Oh, okay.
I guess
I'm almost done, but
I changed that freshman major a couple of times like we all did.
I was very, very like set on doing pre-med. And then the closer I got to needing to get to med school and taking the MCAT, the more I didn't want to do it. And I put it off and I was like, maybe I don't want to be an MD, because the more MDs I shadowed, the more it felt like they were such an intermediate person in the role, and they would just either prescribe or refer out to PT or refer to surgery. Like it was such a weird spot to be in. It felt like where we're at within medicine, and not every MD is like that. Not every MD practice is like that, but that is the vast majority, especially in like a hospital setting or a clinic setting. Or I really wanted to do orthopedics. And that's really the case in an ortho setting, is you either have to be an ortho surgeon doing surgeries, and then you barely get any patient interaction. It's pretty quick in most cases. Or you are the doc going from room to room, just checking, seeing what's happening, referring for an image, and then checking in on someone after, or referring to surgery or PT. And that just felt not like the right road I wanted to take. I wanted to see someone all the way through. So then I started looking a little more into PT. But physical therapists are a little bit more restricted within their scope. And if you're working underneath a surgeon, you have to practice as that surgeon would prefer for their outcomes, which is fair. And I would totally understand that. If I were the surgeon, I would want someone to do what I would want for good outcomes.
Right.
But I wanted a little bit more autonomy. So then I last minute started shadowing a couple sports chiros, and I'd had chiro growing up, and it was more that traditional form. So I hadn't really seen the rehab side of things. I hadn't seen that there was a bigger scope of practice within chiropractic as a whole. And I kind of fell into my niche then and saw that there was more that I could do with it. And then I could own my own business too, which is also something I wanted to do. So just kind of worked out, and I got in, and then I went to school. But it was a very kind of last minute decision.
Well, and it sounds like the autonomy and then those interpersonal relationships that you can develop and establish with your clientele was also a big proponent of your decision in that process. Yeah. My girlfriend is a physician's assistant, and she worked on the orthopedic side, and then wanted to transition to ear, nose, and throat so she could work with her own patients and have that, kind of relationship
just
dynamic.
A little bit more personal.
Yeah.
I feel like ortho, it's hard to get personal with patients. Like it's really quick interactions a lot of the times. And that's not always the case. But in my experience in ortho offices, like the people I knew the most were my PTs, or were those people who were working directly with me for 30 minutes on end. My doctors I knew pretty well, but I would see them for 15 minutes and then I'd see them again if something else came up, or at an 8-week checkup for 5 minutes. So I wanted to just have a little bit more closeness with those patients and be able to work a little bit closer with them and kind of find out what their why is, what their goals are, what can we get you back to.
And that's kind of, to me, that I desire and that kind of that feeling really makes a lot of sense to why you are also still coaching, why you're also still in kind of like that fitness realm and doing the certified personal training, because you do get a lot more of that interaction. So did you want to do that kind of like after the chiro thing? Was it kind of like, hey, I want to do this in conjunction, or kind of what was your background there?
So when I started grad school, I was selling wedding dresses on the side. So I was doing sales just as like a part-time job on the weekends to help pay for school. And then I was working out at Orange Theory starting in 2020, and I really enjoyed it there. And I'd never really found that like gym feeling that you get when you're there. It's just a community and it's fun. And I was a college athlete, so it kind of gave me that feeling that I was on a team and kind of competing with myself and secretly with the people next to me, even though they didn't know it. But I was looking at their speeds. But
I saw you glance over.
Yeah, 0.1. Like, what the fuck?
Yeah, I was like, man, now I have to do better. So
those are some of the funnest moments in class when you're like, get somebody next to you on the tread and you're like, oh, you're going for it too. Okay, all right.
Yeah.
You see each other bumping it up. I love that.
Exactly. So I joined Orange Theory as a member in 2020. And then I was like, I'm in grad school. I can't afford this. Like my loans were getting bigger because I was an Orange Theory member. And that's not what we should be doing. So I applied for a part-time job to do the desk with a goal of eventually coaching. And then I started coaching and I was like, okay, I can see how I can continue doing this. Because before it was just going to get me through grad school. And then it just made sense to keep on coaching because it was aligning so much with what I was doing in clinic. And you get to see so much in person and you're seeing how people move so often that it was helping me in my clinical side of things, because I see how people are deadlifting in this class every single day. I probably know how my patients are deadlifting at home, or if they're getting this type of pain, I probably know how we can tweak it right away. And now it works out because a lot of my patients do come from Orange Theory. So I know what workouts they're doing every single day. I know what to expect for them for the next month or two. And we can plan around that and we can modify it so then they don't have to stop going, which has been really fun.
How important is that you know kind of what their routine is to a T?
It helps. It doesn't make or break anything. Like I do have patients who don't go to Orange Theory too, so I don't know their routine exactly, but it helps especially with the rehab side of things. So I know someone at Orange Theory, I know the workouts they're going to be doing and the movements they're going to be doing. So how do we need to modify that? Or can I just give you exercises that I know you're already going to be doing in Orange Theory? So then at least the chances of you doing those exercises goes up so much more because people hate doing rehab anyways. Mm-hmm. So how can we make it so that you're just doing it at the gym because you're already going to be there?
Mm-hmm. Yeah, that's a really good way to make that process easier and for them to be able to actually carry out their protocol that you have set up for them to like, hey, have you been doing your rehab exercises? And they're like, nope. But then if you can do that already within the activity of the workout itself, that's a seamless transition.
Yeah, it's a little sneaky. Like, I know you're going to be doing this, so we're going to program that in.
Well, and how do you handle that when a potential client of yours, walks to the office, you're doing the 10-minute phone call assessment, and they might say over the phone, like, oh yeah, I was told I should never deadlift, or I'm never going to deadlift again, or squat again, or I was told it was like bad to run for me because my joints are getting a little sore, those kind of questions posed to you.
Yep. I mean, I hear that a lot where someone has told them at one point that they shouldn't do a certain movement, and within reason, like, okay, we're going to empathize with it a little bit. Like, you have a fear of this movement now because someone told you shouldn't do it. I was told when I was 15 that I should never deadlift again. And then I lived with that fear for so many years until I got to college. And I had an athletic trainer who was like, no, you can for sure deadlift. Like, here's how we progress to it. Like, don't just go out, grab a bar and start deadlifting, but how do we progress to that movement to make sure you're safe when you do it? But also getting your body to gain that tolerance back for that movement, because there's a reason it caused pain before. So can we just regress it a little bit and build back up to it? So it's same thing with running. Like, why can't you run? What's the point of not running? how can we build up to running? Maybe we need to start a little bit slower. Maybe the last time you ran, you went in way too quick, or maybe you got injured and now you've taken a break and it hurts when you run now because you're trying to go back to where you were when you ended. So it's kind of just about scaling back into those movements. But I'm never going to be one to say like, you can't do that unless there is something really glaring that like physiologically, yeah, you can't do that. Like there are some people who cannot get into a deep squat, like a yoga squat. I know a lot of people, their hips are just designed where they cannot get that deep, and that's fine. But that's something that we can't control. If it is controllable, or it's just like, oh, a doctor told me not to squat ever again with a bar on my back. Okay, why? First of all, is going to be the question. And then how can we build up to that if that is something that they truly want to be doing?
Now, what was your own personal experience with that when you met with your athletic trainer? You had this fear of, I can never deadlift again. Your athletic career at that point, your idea of, oh, this might be a profession in an area that I want to pursue as well. And you're having these doubts as to, okay, wait, can I actually deadlift? Is this okay? And then what was that experience like when you're working alongside your trainer to get you back to the point where you felt confident in your ability and your body's ability to perform and do the things that you wanted it to do?
Yep. So I guess the reason I was told I couldn't deadlift is I had a disc herniation that happened when I was younger, and it did have like ridiculous symptoms. So I had shooting down the legs. I had some weakness, and it calmed down really quickly because I was young. I was 15 or 16. But then my ortho said, you shouldn't deadlift anymore. You shouldn't do any hinging movements, which if you look at a hockey player, which is what I played, it's a lot of hinging. Like I'm already doing that motion on the ice when I'm skating. There's a lot of like squatting with it, but it is a lot of hinging forward.
Is that where the injury occurred, was during hockey, or?
Probably. I mean, it was just a lot of overuse or something.
Okay.
We don't know exactly for sure, but it's just, it could have been genetic. Like it just could have been perfect place, perfect time. That disc just was mad and decided to push up against some nerves, and we went from there. But yeah, that doctor told me to never deadlift. And I was like, cool, I don't need to deadlift to play hockey, but like it would have been really helpful for my strength knowing this now. Like I probably should have been deadlifting. That probably would have helped prevent other injuries that came up later on, but that's beside the point. So I'm in college. We have these strength programs, and I'm like, I need a modification for a deadlift because I can't do it. And she was like, why? Like, which is now, like I said. And I was like, well, you know, like my back issues, like you treat me every day, you know. And she was like, but you should be able to like work up to that. And I was like, I don't know how. Like, what do you mean? Like I'm being told I can't deadlift, so I'm not going to deadlift. And so she created a program that really focused on a lot of core stability. It was really like kind of low back rehab focused, which I had never done before, but it was a lot more tailored towards my sport and what I was doing. Even when I went to PT for it, it was still like pretty cookie cutter, like here's what you should be doing, but it didn't get to that next level that I needed as a collegiate athlete, which is fine because I had this person or athletic trainer who came in and did it for me. And then all of a sudden, this was like the middle of the winter. And then by that next summer, I was deadlifting and it wasn't painful. And I was able to up my weights and I was able to control the movement. And yeah, it just took that progressive exercise to build back up to it, which is kind of where it sparked in me like, okay, we can do something like this. Like there are so many factors that are missing in a lot of care right now where we stop as soon as the person stops feeling pain, which is great because I was out of pain, but my physical therapist saw me out of pain and that's where it ended. Within that, and that's not every physical therapy office either. And I don't want to generalize, but in a lot of places, that's where it stops. But that doesn't mean that my abilities and the athletic stuff that I wanted to be doing was where I needed it to be a collegiate athlete and perform at the level that I needed to, which I did make it through and it was great. But were there other things that could have happened in that time between being 15 with that injury and being 20 when I finally deadlifted again in those 5 years that we could have just made it a little bit quicker? And what could that have done for me as an athlete as a whole and for my pain levels as a whole?
Mm-hmm. Well, and it's such a pivotal point in your life too, like how that now you see yourself in your career. And I would imagine thinking back on that experience of yours is kind of powerful.
Yeah.
I would imagine.
Yeah.
I love that. Oh, you're going to have to teach me to skate the winter, by the way.
I don't know if I have the patience to teach anyone to skate.
Wow.
I've only done it once, so I'm out.
I tried to teach my husband and I just couldn't. I was like, you push. Like, that's it. You just glide. And like
He's
everyone
falling over meanwhile.
everyone wants to just walk. And I'm like, just keep your feet and just push off and glide. Like, that's
Sure.
it.
I can't stop. I should say that. I can skate. I can't stop.
You probably just need to bend your knees.
I'm going to try that.
That's simple, dude.
I'm gonna try
Bend the
that.
knees,
Just
bro.
try it out. Let's go.
That was like the same thing with rollerblading, though. Back in the day, as like a little kid, you go to the roller rink, you know, on whatever little vacation that you're doing at your middle school, and then all of a sudden, I had to run into the wall.
Sure.
That was my go-to way
That
to
was
stop.
like the Mighty Ducks. That was one of the characters from one of the first show, the first movie, I believe, right?
Yeah.
They couldn't stop. So they just
I
keep
think
going.
it was, I want to say it was the second one when they went to like the Junior World Games
Sure.
and they brought a bunch of kids from every country.
Yeah.
I think one of the kids couldn't stop. Maybe it was in the first one too. Maybe I'm putting them all into one movie.
It's easy to do that. I remember the third movie was like they were all like pretty old.
Wait, there was a third Mighty Ducks movie.
Yes.
Oh my
They were all,
gosh.
It's so good.
they
They're
were
at like boarding school.
Yeah.
Oh my
Yeah.
goodness. I didn't even know that there was 3. So many.
Yeah, they went hard with those movies.
We gotta do a D3 Mighty Ducks or D1. I guess D3 was the third movie. I think we gotta do a Mighty Ducks. You gotta do a movie marathon.
Oh, at some point.
The only trilogy to rival Lord of the Rings is
Yeah.
the Mighty Ducks trilogy.
Right up there.
Facts.
Dude, we went to Twisters last night and saw that movie for the first time.
It's so good.
So good.
It's so good.
What's the main actor's name?
Glenn Powell.
God damn, he's a good looking man.
He is incredible.
Oh, well, and we got there, so the showtime is like at 6:15. I did not realize that there's 30 minutes of previews.
Oh, yeah.
I'm like, wow, it's 6:45 and this thing hasn't even started yet. I'm like, my goodness.
Corey's bedtime is 7:50.
Yeah.
Like I gotta get home.
But the moment
This
Glenn
is too
Powell's
much
face
for
popped
me.
up, I was up for it. You said you saw that one?
I did. It was so good.
Mhm.
I love the original Twister, so it was really fun.
Oh, it's amazing. You,
See the remake.
Corey, you're looking at us here. Have you seen this?
No.
No.
I've seen the original Twister with Carrie Elwes. Carrie Elwes. I always forget how to pronounce his last name, but he was the guy in Robin Hood Men in Tights.
Yes.
He was
Oh,
in,
yeah, wow.
Princess Bride.
Yeah.
He was in Saw later. Like he was like
Oh,
the
yeah.
doctor.
Philip
He
Seymour
has-
Hoffman.
His southern accent in Twister is so bad.
Yeah,
It
he's
is.
British. That makes sense.
It's so horrible.
Right, y'all. So here we go. These damn Twisters are coming our way. I'll tell you what, Ma. I have not seen Twisters, however. So what makes it a good film?
I mean, after you.
You're just entertained
Okay.
the whole time.
Entertained the whole
It
time.
doesn't stop.
Okay.
You just like, give me more. I want to see more of these tornadoes destroying things. I don't know.
All
Something
Twisters
about.
all the time.
And then Glenn Powell is just being charming as ever.
You almost want to dislike him, but it's just, you can't. Yeah, you're just
It's
mesmerized.
impossible.
Mm-hmm.
He smiles and the world stops.
Okay.
Mhm.
Yeah, I've seen the memes, but I haven't seen the movie.
It's
But,
quality. It
okay.
does a really good job of like paying homage to the original film as well. They do a lot of little subtleties where it's like a little kickback, like even their little finger snap thing. And,
Yeah.
Okay.
Yeah, even the
Cute.
truck that he drives, you look back, you're like, oh wait, yeah, that's that red Dodge. Yeah, they do a really good job with it.
Okay.
Mhm.
Cool. What I was gonna ask like a injury and twist related question, but I couldn't think of one. I was like, what is the worst injury you've seen after a tornado?
Pull it all together.
Pull it all together. I would say so. Like earlier on, we were talking about the running and the destroying of the body, and we we're talking about, and like Corey and I have mentioned before, and this is something that being at Orange Theory, you probably have heard this already too. Is that people? So in Minnesota, if anybody's listening to this not from the area, Minnesota is very much like when it's summer, and there's 3 months where you get outside and you do all the things that you wanted to do the last 9 months, and you get it done because as soon as fall rolls around, it's like we have basically from late October, early November to mid-April, early May. It's basically winter, right? Like it's spring-ish, but it's like it's winter.
It's gross. It's always like the spring is always it's just wet outside, so you don't want to be outside because there's so much snow melting.
Our spring is like a month long. Maybe not even that. It's like all of a sudden it's sunny and June and hot as shit. So like for you, we've heard a lot of like people always like canceling their cross training or doing cross training, or they're like, oh, I have this half marathon, I have this 10-mile race, I've got this marathon, and they all are like, I have to start running outside and I can't do anything else. And it's like they always cancel. I'm like, what else are you going to be doing? So you mentioned that part of the reason why you were struggling with this was because like you weren't doing cross training, you weren't doing your rehab, but like it was kind of like it was like that was kind of part of it. So tell us about like when someone talks to you and says, I'm going to stop cross training, I'm going to stop doing this because I'm going to dedicate all my time to running. What like goes through your head, or kind of like what would you tell them?
My first question is always going to be why, which sounds so redundant, but that's always it. Like if someone tells me they want to do something, I'm going to ask you why. What's the reasoning behind that? And I'll say, if it were me, I probably would keep strength training because that's going to keep me healthier to run and help keep my joints feeling good when I'm running and help prevent those injuries as that mileage ramps up. Like you don't have to go work out at the same level that you are right now, but you should probably do some strength training 2 times a week, at least if you are going to be running at a high mileage, to just get that full injury prevention. Because when we're strength training, we're putting our joints under load, and that's going to help them handle a lot more later on. And it's also just helping those muscles too, and working your body in a different way. If we keep doing the same thing every single day, something's going to wear down at some point. It's not going to feel good. You're going to start to get those overuse injuries. You're going to start to see things break down, or your body just doesn't like that monotony. So your like even mental capacity for running might go down. So it's good to have variety and mix it up a little bit. It's kind of how I like to phrase it. And I mean, just saying like, if you don't want to cross train, here are the risks of what could happen. Like, here's what could happen. You could lose your enjoyment of it. You could start to taper off midway through training because you've been overtraining and overdoing one thing, versus what you could be doing is just mixing it up a little bit and getting the same benefits.
I like that you did lead with like what some of the risks are, because first off, then you're presenting them with these options, but then one of the first thing you said was like you might lose your enjoyment of it. And I think that's a really big thing too, because I think that like, I don't know, especially when we have goals in the health and wellness industry, when we start working towards those almost like obsessively, it's easy to lose sight of like the actual enjoyment of the thing. I did want to ask you too, you talked about overuse injuries, and we all know that like there's a lot of pressure, especially in American culture, to succeed in sports as like a youth and all the way through college, and then everything else. So like, how many like teenagers, how many kids like do you see, like, and do you see that?
I see quite a few. I think the youngest I see is around 10 or 11, and then I go through high school, and I have some college athletes as well. But the majority of the athletes who are younger that I see, and this is not a dig at them or anything, because I want to clarify, I was a one sport athlete most of my life, but most of the kids who are getting hurt are single sport athletes and really honing in. And it's not also to say that if you're not a single sport athlete, if you're a 3-sport athlete or a 2-sport athlete, you will probably still get hurt at some point. Like, but the injuries are so much different. So like my injury was probably more of an overuse injury. Like herniated disc at 16 is a little rare and kind of weird, but that's probably because I was primarily playing hockey year round and I really didn't take much time off, but I was constantly doing that same repetitive motion over and over and over. And all of a sudden my body just said, we don't like this anymore. And that, I mean, and it's hard to say, but I think there is a benefit to cross training or doing multi-sports as a kid. I think there are tons of studies that prove that kids who do more than one sport are going to be less likely to get injured, and they're going to have way more enjoyment out of their sports too.
Sure. And then you wonder when watching the Olympics, like I associate this sometimes when I think of gymnastics in particular, like, oh, you have to get in early. And a lot of like Simone Biles just won the all around US Olympic gold at the age of 27. And there was some figure that I believe I saw where the all around champion was generally at 20 years of age or younger.
Yep.
And then so at an early age, if you demonstrate a incredible skill set and capacity for a particular sport, like how do you differentiate between recommending, oh, yeah, I would do this X, Y, or Z sport, or you might actually have a shot, and let's really kind of push the chips in here.
Well, and like with any decision, there's a risk you could run. I mean, those gymnasts probably weren't multi-sport athletes. They probably were 2 years old in the gym, and then they've been in the gym since then. And that works out just fine. But gymnasts are also really known for injury. So they're really prone to injury, but it's also a really intense sport. So it's like, how do you differentiate? We have like these studies that show like, yeah, kids who do multi-sports are shown to be happier and enjoy their sports more. And they're prone to less injury than kids who do single sports. However, me and my siblings, we all did hockey, and that's it. Like, we sometimes dabbled in other sports. Like, I think I did 2 seasons of swimming in middle school.
Everybody's
and maybe
swimming.
maybe 1 season of track in middle school. But after high school, it was like, that's it. And before middle school, it was just hockey too. So, and none of us started hating the game either. We all loved hockey, and we still love playing hockey. So you can't really say what's going to work for each kid too. Like, if you're a kid and you don't want to play 2 sports, like, I didn't find enjoyment in any other sports. I didn't want to go out and do anything else. I hated soccer. I hated anything else I could have been doing. So it's like, you just gotta have fun with it, I guess.
Well, and then I wonder, when you get to the level that we're seeing athletes on the Olympic stage at, you recognize that there's an inherent level of just God-given ability, and you have a gift, also the incredible work ethic. But to the point that you said, they also, I would hope, absolutely love the sport, and all be all that sport in particular. You wonder also, on the flip side of that coin, how many people get into it because they did have the ability, they had a good work ethic, but deep down it just wasn't really their thing, and they just burnt out.
Yeah. I mean, you'll never know. And like, if you're like, what's better? I don't know. I can't give an answer on that. Like, yeah, based off research, we should be doing multi-sports, but I was not a multi-sport athlete. And when I was a multi-sport athlete, I would prefer to play hockey.
Mm-hmm. In hindsight, would you have wanted to go back and change? I mean, the whole what if scenario, but like, looking back, you loved hockey. Would you have, wanted to potentially pursue other areas?
I like running now, but and so I'm like, maybe I like could have done well in track, or like, I see certain sports like soccer. I'm like, I can run really well. Like, I probably could have been pretty good at soccer and enjoyed that if I had gotten past my 6-year-old team that I just got bored on. But like, who knows? I don't know.
Never came to you, so you were just in the field picking dandelions, and you're like, this sucks, I'm out.
That was it. Like, I was just bored playing soccer, so I quit. And I don't know, I just enjoyed hockey. And if I had been a runner, and if I had done track in high school, like long term, would I enjoy running now? So it's like, who knows? Because I know a lot of people who ran in high school and who ran in college who will not get out and run right now.
Mm-hmm. That was kind of how I felt after I was wrapping up baseball. Was I even stopped watching it? Like, it just became such a disinterest to me anymore. I was like, I don't even want to watch it. Like, I don't want to engage at all, because it was like, at that point, it was like, I think also it feels like if you don't make it to a certain level, you kind of fail in a way.
Yeah.
Right. And so it's like, and I think a lot of those players, or a lot of those people, like, did multi-sports. Like, you even think of like LeBron James, or like even like a Joe Mauer who played college football, and it's like, or he could have played college football, right? It's like, I could have gone this, could have gone that. It's like these people are just excelling at every single sport they play. So,
well, I think one of our male volleyball players, I think he's beach volleyball, he was a Timberwolf.
Yeah, Chase Budinger.
Yeah, like, he did volleyball and he did basketball. Like, all these high level athletes, a lot of them did get the opportunity to play another sport before going into their sport of choice, which I think is crazy. And maybe that just shows like, okay, they're just an athlete. Like, they can do anything if they want to try, but I don't know.
I do got to give a shout out to the women's rugby team at the Olympics, who got bronze medal, which is actually a pretty big deal for them. So
that was
shout out.
So fun to watch. They're incredible.
Well, especially like rugby sevens. Like, when we brought that up on the latest episode, I hadn't seen rugby live in, I don't know, however long. That might have been the first game that I watched ever. But the sevens, way faster pace. And then apparently, I didn't see it, but did the United States essentially win on what would have been the equivalent of like a 99-yard return for a score at the very end of the game and then the kick to win it.
Let me go into detail.
Wow.
So, all right, y'all, we're going to do a little rugby segment here. Sorry that you're all listening to this right now. So in rugby, basically when the clock ticks, so rugby is played continuously, kind of like soccer, right? When the clock ticks, like the clock just keeps going. When the clock hits 0, if the ball is still in play, like you just keep going, right? Or like, you know, if like one team has possession and they have the ball and they're moving, it's not like a football where it's like as soon as the clock hits 0, the game's over, right? So the U.S. team had the ball inside of their own territory, like deep inside of their own, basically inside of their own end zone, with 0 seconds left in the clock. And so basically it was like the next, if they were, you know, if they got this try and then scored the conversion, they were going to win because there's no time left. So yeah, they broke a couple of tackles, and in rugby sevens, that's it. It's very fast paced, 7 players aside on a field bigger than a football field. So it's like if you miss a tackle, you know what I mean? And in this case, they
one cut
2.
and gone.
Well, and some people were saying like, oh, the other woman was just standing there. I was like, yeah, because they are sprinting for 15 fucking minutes. Like, of course,
you're exhausted.
Yeah, you know what I mean? So it's like that's that mental lapse, where it's like that last little bit of like, if you're not attacking that, like you need to give up the try to win. So shout out to the US team. I think they deserved it. That was a tough fight, and Canada almost beat, but they were pretty tight with New Zealand for a while. New Zealand is like the best of the best, so that's pretty cool to see.
Who's one of the main athletes on the U.S. women's rugby team? She was the one. This would have just been.
Is it Alona Mar?
That's it. Thank you. Yes,
the one that's kind of been like
the face.
Yeah,
almost of that team.
And she's fucking jacked. Like, I mean, that was the U.S.'s kind of ticket through qualifying, was that they were just bigger than everybody else. I mean, like Alona Mar was 200 pounds, like she's pulling people over. But then once they got to, then they beat Great Britain in the quarterfinals, and then once they got to the New Zealand game. I mean, New Zealand's just the same size, and they're also just like very, very. I mean, that's their sport. You know what I mean? The All Blacks, and so they were really good too. And Canada has some really good players as well. They've got some like really good veterans. And Australia, Charlotte Caslick is really good for Australia. She's kind of like leads the team there. And they had, I forget her name, Tegan something, but she was just a sprinter, but they still fucking won, pulled it out. So,
well, I love that it was Ilona. Is her name?
Ilona.
Now that I've been watching the Olympics, my algorithm is all, of course, just Olympic heavy. And then she has now popped up on multiple reels. And I've thought for like really interesting points where there was one, she talked about this interaction she had with while going through the grocery store. She was wearing an Olympic hat, and a bystander just happened to comment like, oh, you go to the Olympics? Like, are you an athlete? And she says, yes. And they assumed that she was a gymnast. It's like and she jokes around with it, like all 5 foot, whatever she is, and, 200 pounds of me. And she just kind of laughs at the interaction. And then another reel is her commenting about how her BMI score would consider her to be overweight. And I'm like, yeah, but you're an elite level Olympian. And she refers back to that, be like, whatever, and just kind of brushes it off. And I loved that. I loved that.
Yeah. BMI is a very shitty metric to get fitness or anything. So
it is.
Don't use it.
Really outdated.
Yeah. It is really outdated. And I don't think it was even designed by someone who was like even knowledgeable of this. Anyways, side note, but yes. So Maggie, I want to ask you like one other thing, like, do you, and this just like anything that you feel like you want to chat about, anything that like you feel like you want to pop in here, or you have any questions for us?
Oh, wow.
Turning the tables.
I don't know. I guess I guess you've seen me, but I mean, what are your experiences within like injuries? I guess like getting away from sports, like or getting away from an activity. How do you get back to your own activities? Like, let's say you broke your ankle tomorrow. What's your game plan?
Oh shit! Oh, ankle, damn! Like, wow, fuck.
No, maybe not that bold. Or like,
no. That
pull
bold.
your quad.
You broke your ankle.
Like, it's done. It's just
ankle.
Snapped.
Gosh, yeah, leading right up to this ultra right in October. God, no, I'm hoping not, man. No, knock on wood. I mean, obviously, yeah, you got to see like your medical professional. If you need surgery, you need surgery. You see your PT if you need to see a chiro, whatever the again course of action that you need to take. I mean, you need to take it. If that also means time off accordingly, right now, thankfully, I'm not injured. So I hope
or I guess
that's
like
the case.
what have like either of your experiences been like coming through injuries? Because I see the way I do it, and like I think obviously I wouldn't do it if I didn't think I was doing it the right way, which sounds conceited, but that's nobody's going to do something if they think they're doing it wrong. Like there are chiropractors who are adjusting people in and out every single day, and they fully believe like that is the only way to do it and the best way to do it. And that's great. But like what, as like, I guess non-providers, what do you want out of providers?
Well, I think you touched on some important aspects of it, is wanting that client of yours to eventually no longer become a client and giving those remedies, the protocols and practices they need to do outside of your office to ultimately become successful and succeed in the full rehabilitation and strength of that injury. My only experience with chiropractic was a very brief stint for a couple months that, I got a deal through the employer that I was working for at the time, popped in, and it was just like how you had mentioned, quick crack and whack and you're out. And no, that's what it was. You just walk in, bing, bang, boom, done. Yep. Get out of here.
We got to think of a business plan that we can call something the crack and whack.
No, get cracked and whacked.
I'll just change my name now. I'll change my entire plan. I'm like, you know what? That name is too good.
Mm-hmm. Well, and then it's like, it was an enjoyable experience. I mean, it always feels good. I mean, everybody can, I think, attest to that, whether or not you're actually seen a, licensed chiropractor, or if you were just the school kid that, went and turned around, grabbed your chair and, gave a little pop. Shit feels great. And if it's actually helping and assisting in your recovery, if it's, also just gives you the little mental space and reprieve, and you have a great relationship with your chiro, I mean, hey, keep going. Who am I to stop you,
Yeah, I started seeing chiropractor way back in the day, back in like basically I started doing CrossFit. Makes sense, right? So, because also a lot of CrossFit gyms have like chiros attached or have chiros that they refer to. And so I started seeing Ross at Chiro Sport, of course. And so shout out Ross, he's a pretty cool guy. Yeah, so, and we did a lot of that adjusting, but I would basically, and body work, the scraping, the cupping, things like that, dry needles, whatever we would do, like little stim needles. He had some other things that we worked on. So a lot of what I was seeing him for was like, hey, I'm dealing with this pain or this tightness. And it'd be like more of a tune-up. However, when I wanted to do more of like exercises, or I was asking him for things, he would give those to me. I've seen Courtney as well, who's a friend of yours, of course.
Yeah, Chiro Sport works really similarly to me. Like when I am hurt, I see Courtney.
Yeah, perfect. Courtney's great.
I go to Chiro Sport for my care, and she will come see me too, which is fun. I
love Courtney. She's she's a very like calm, very like comfortable demeanor. And then like I've done movements with her with cups on that I'm like, this is a terrible pain. And she's like, just do that. And it's like so calm. And I'm like, she's great.
Every time I get treated, I'm like, whoa, I am mean to people. And it's always with her. It's like, am I doing this to people? Like I have to move right now with these cups on my body.
Do you, are you able to gauge kind of like, hey, this person probably couldn't deal with this? Like when you're talking with them, or
it's so I guess like in terms of like a muscle work or an exercise.
Yeah. So I've heard, like, okay, well, people that are maybe more not in tune with their pain, but kind of more like consumed by their pain. Like maybe it's so much that like you're like, hey, if I know that if I do this cupping or this scraping, that like this is going to be too much.
Yeah, I mean, you can, if someone's in pain, I always have to ask people to tell me if they're in pain too, especially if they're face down, because especially women who have had children and given birth, they're going to talk through anything.
Their pain tolerance is out of the world.
Absurd. I'm like, are you good? Like, and they're like, yeah, easy. And I'll ask like what level of pain. They're like, it's an 8. And I'm like, okay, we need to scale it back because I shouldn't be putting you at an 8 out of 10. But
oh yeah, I'm at a 10.
They're like smiling, no grimace. It's just like, whatever. I've had a kid. I'm like, okay, fine. But
I love that.
So I do have to check in a lot. Like, how's this feeling? Where are you feeling this? And then if it's too much, I've had patients where I've just sat and been like, we're going to belly breathe for a little bit. Like, let's take that threshold down a little bit. Because if you're at a 10, like what's going to bring you down? And usually that's breathing and just getting you out of that fight or flight state.
Sure. Okay. Yeah, I was curious about that. But in general, I mean, I don't know. Like my worst injury was my ACL tear in college, playing rugby. There we go. And And I think that was really tough. I had a great PT at the time, or a great PTA. I mean, great PT too, but you mostly seen by the PTA, right? Great PTA that kind of really helped me through that rehab process. But yeah, I mean, I think it's terrifying when you're dealing with something where it's like you don't know the outcome, especially if like it's your first time doing it. People do tend to tear their ACLs multiple times, unfortunately, or they tear the other one. I actually have the notch on my femur is more narrow than others. It's more of a V shape, less of a U shape. So if you're thinking about your knee, right, your femur kind of is like goes over the top part of your knee, inserts in. I'm probably being wrong anatomically, but that's okay. But yeah, so what they're attached is like mine is like more V shape, which apparently so I remember at least makes me more prone to doing something like that. So when I had my ACL reconstruction, they actually shaved down that bit of bone. I don't know if that made things bad or worse, or worse for my recovery, or if it's just like a very normal process. But yeah, I mean, that was tough. I remember like, being upset with, progress and things like that too. But in terms of like, I don't know. I think the weirdest part for me after that injury, or just getting like other things besides like getting range of motion back. And it's like, oh shit, this is the first step. Like, it's not just getting onto like a squat rack or whatever. And then once I was able to squat, I think there's a big mental block of like, I'm so scared to do this again. I mean, I even just saw something. Justin Jefferson, of course, the Vikings receiver, tore his hamstring last year, and he's kind of scared to do it again. And so I think a lot of the time coming back is like, it's the pain level, yes, but also it's just that like mental hurdle of like, I am going to always reserve intensity because I feel like I'm going to hurt something. When I think so that I've been told is like, sometimes that's how you hurt things, is because you are holding back. And then it's like, you're not quite, I don't know the words for it, but.
Yeah. I mean, there is a lot to be said about like the mind and pain in general. And I guess returning to activity. Like if someone doesn't feel safe doing something, they're not going to do it safely because every other muscle in their body is going to be guarding and protecting, and it's not going to go well. So that's not worth doing. So what can we do to like, once again, scale back, or like at least just say like reminding yourself, or just like sitting in the mirror and looking at yourself and saying, I can squat, like I'm able to do this, or just like, what do we need to do to build that trust back up? Like maybe we're not getting under a bar, but maybe we're holding 2 dumbbells on our shoulders so it feels like a bar is there, or like a dowel, just to have that feeling, that sensation of something on your shoulders in the same way. So then you could build back up to that trust. Because a lot of times the brain is really good at protecting, and once it knows that there's been an injury to an area, it likes to think about that a lot, and it likes to keep sending pain signals there, or even just like that awareness there. And that can create a lot of fear around movement, especially after big injuries.
When you hear that a lot of time too, it's like if you go under and then, you'll have your doctor, physician, whomever, and you're like, oh yeah, you could barely get your knee to flex or your hip or your shoulder flexion, whatever. And then once you're knocked out, it's like, oh yeah, you're just like a big old ball of rubber.
Yeah.
So those,
you're a body bag.
Yeah. Again, those like receptors where you're like, nah, we're not going to push that because that actually is a little bit tender. But the moment that you're not cognitively there.
Yeah, which is like a lot of why I do a lot of muscle work, because it kind of tricks the brain into feeling good and like trusting that movement again, and trusting that like things are safe. Nothing is horribly hurt. Like we can move within reason. So that's where a lot of that soft tissue work comes in and seems to help. It doesn't help everyone, and not everyone loves soft tissue work, but for a majority of people, it does really help just take that level of stress down and that level of panic, just like from the brain, and that fear away.
Well, Meg will tell me stories sometimes of clients that like, if they're looking at like shoulder flexion, like, oh, I can only raise my shoulder to here. And then like she sees them 10 minutes later, reach up on the shelf and grab something. It's like, wait a minute, you just said, like, what I mean? So it's like that mindset where it's like, sometimes we deal with limiting beliefs for kind of what we're doing in our rehab. And so like, I imagine that as someone who deals with that a lot, that's kind of a tough like nut to crack kind of.
Yeah. It's fun. Like it keeps it interesting for sure. That's what's fun about it, is it's like, okay, how can we kind of gaslight the brain into feeling good again and trusting these movements, and trusting that like if we do this movement, this part of the body is not going to get injured worse. Mm-hmm. And that's just knowing like little tweaks we can make. So a lot of times if like someone doesn't want to lift their shoulder all the way up, we start with just like ball rolls right here, and then like eventually we'll just trickle our way up. and all of a sudden you're just all the way up overhead. And I don't know why that works, but it does.
Sure.
Well, then I feel like as though your area in particular is going to continue to grow and build, especially with the state of the nation right now, where sedentary lifestyle and behaviors are way more prevalent and also, I think, accepted to a large degree. And I think moving forward, do you see that your potential clientele, I feel, is just going to continue to grow and grow and grow because of, unfortunately, those aspects of our life that we now just consider, I think, quote unquote, normal.
Yeah, I can't believe how painful it is to sit. Like, I will have days, or I went to a conference and I had to sit for 8 hours, 2 days in a row, and my body hurts so bad afterwards. And I'm like, no wonder everyone's in pain. Nobody's getting up and moving. And I will say to people with office and desk jobs, I'm like, if you just set a timer every hour, just get up and move in some capacity, that is going to make such a big difference. Like, posture, I don't think it has. I think it's whatever. I sit however you want, as long as you're not sitting in the same position for 8 hours at a time. If you're standing for 8 hours, you're going to be in pain. If you're sitting and slouched for 8 hours, if you're going to be in pain. If you're sitting straight up with perfect posture, you are going to be in pain if you sit like that for 8 hours. Our bodies don't want to be in one place for a long period of time. So my biggest thing is like every hour, just get up and move.
When you bring up such an interesting point too, you hear that all the time, like, oh, look at your quote unquote posture. It's like, in my mind, there's really no such thing as posture. It's kind of like almost a mirage in that way. It's like, no, move your body in those joints through a full range of motion every day. Like, no, you're never supposed to bend your spine. Like, what are you talking about? Yeah, you want to flex and extend and rotate. Bendy as shit. And it's like, do that all the time.
Some Gumby ass.
Yeah, honestly, though. I mean, like, you look at, especially as we start to age, and I look at where ultimately I want to be when I'm in my 60s. So like where we all want to be. You see people that are locked up. They can't, again, our shoulder flexion, they look like they're just cement type of joints. You're like, that's not what we should be shooting for. And people are like that now, already in their 50s and their 60s, and they don't get out ahead of this situation. And it's only going to make that harder on down the line.
Yeah, it's the big thing is like use it or lose it. So like that's with mobility. Like if you move, you're going to keep that movement. It's not just going to go away one day when you turn 50 or when you turn 60. It doesn't just go away. Like a lot of people talk about when they turn 30, they get back pain. Like, no, you probably had back pain a little bit in your 20s, but now you're 30. So you're really going to focus on it a little more and like hyperfixate on it. Like just move and it'll probably go away.
Well, you're saying I can't complain about being 30, almost 33 anymore?
No.
Damn it.
What would you say in your mind? Because I feel, would you fair to say that a lot of us, especially when it comes to training, we're all about wanting to potentially move or shift like a big heavy weight on a back squat. We love to maybe go out for our training runs and miles, but the moment that you recommend for someone to sit in maybe a slightly uncomfortable position to work on some stretches or work on some mobility or do their rehab exercises, do your accessories in the training program as opposed to the big lifts, so many people are not inclined to do it, myself included, where I'm like, I should be doing this more often. But like, why is that just, I feel so prevalent for each and every one of us?
It's not fun and you don't see the immediate benefit. Like it's not going to benefit you until you're 60.
Yep.
Like that's the hard part is we're all about instant gratification. And like, you can see that, like you can feel a really good lift, but like with mobility, you can make it fun. Like you can see, whoa, I could not lift my leg that high a week ago, but now I can because I've been focusing on this mobility for a week consistently. And like you can see those changes there. So it's like, how can you track that progress? Because that's what we're just looking to see. And a lot of people don't see that. And the same thing with rehab. It's like you do your exercises once and you don't see much change. So why would I keep doing that? But if you're consistent with them, yeah, you're going to see that pain go down. You're going to see that strength build back up and you're going to feel better. So then it feels more worthwhile to do those exercises and those movements.
Because they're not the sexy ones. They're not the ones that get posted on social media. You're not doing the big lift. You're not doing the big pose or whatnot. But it's equivalent to that of like, let's say you're wanting to cut down a little bit of weight and you're doing a progress photo after every 2 weeks. And there's just a little change there. But you notice that and you're like, oh my gosh, this fires me up. I can't wait to continue on this path. Similarly, I would imagine with your clients, you're doing that. Oh yeah, when we were doing the little spider crawl up the wall, you could only get to here. And now we're a good 2 to 3 inches past that.
Yeah. And it's just like looking at those little things and like reminding people like, you couldn't do that a week ago. Like you felt pain doing that motion. Like, and it can get frustrating, especially in cases of chronic pain where people are in pain for years and years and years, and trying to put it in perspective of okay, you felt pain 7 days the week prior. Now you're feeling pain 6.5 days. Like you had half a day without pain. That's a win. Or like you had a little bit of pain, but now your range of motion is bigger. So like yes, you were still in the same amount of pain, but your arm lifted all the way up overhead, where before it was just going up to 90 degrees. So it's like, how do we put that in perspective while also understanding that they are still uncomfortable and they are still in pain? But yeah, kind of tangent on that one.
Well, I think like you mentioned kind of the frequency or kind of like level of pain going down, even though you're still having it. I mean, like I was at a point back kind of when I started seeing you where it's like every time I would run, no matter what the distance was, I was getting some sort of knee pain or kind of like a swelling in the knee, kind of like it feels like fluid, stuff like that feels kind of like blocky or thick. And, like I've gone on 4-mile runs with Meg. I've gone on like a 3-mile run, and again with her, because I'm not going to do this on my own. Really just rely on her to keep me moving. And things like that. And I can go to it like, I can jog during Orange Theory classes and the whole time and not feel that same amount of pain. And that's a huge win. Like I might still have it, right? But it's like the fact that you're going down in both intensity and frequency, that is actually progressing. But that's still a sign to keep continuing you doing your exercises and doing your stretches and your movements to make sure that is continuing to get lessened.
Even when like pain is at a 0, you still should probably be doing your rehab for a month or two at least past that, if not forever. Like you should always be doing some type of mobility and some type of movement outside of your standard workout. But a lot of people will feel better and they're like, oh, I'm done, so I never will do my exercise again. And then 2 weeks later, their pain is 100% back because it wasn't quite healed. We just built up a little more tolerance, but that body still needed that extra boost of strengthening that wasn't quite there. So like just because you're pain-free doesn't mean you're done. So I always like to say like keep doing your exercises for at least a month after you stop feeling pain. And if the pain comes back, go right back into those exercises. A lot of people will get that pain back and they panic and then they forget all their rehab, which is crazy. But like,
oh, this didn't work for me. It's like, oh, well.
It's like it did, but you stopped. So it's just like being able to like put that back in perspective too. Like you do need to stay consistent with it. Like same thing with mobility. If you don't do mobility, you're not going to have mobility. If you don't do your exercises, like you did have an injury, we need to make sure that you are progressing even if you don't have pain.
Now, I'd be curious in your experience, do you find that the average Jane or Joe is a little bit more challenged when it comes to adhering to the program that you have them set forth versus working with, let's say, an athlete? Do athletes, in your experience, have a little bit more of a dedication to program adherence because they recognize the importance of their body and what they want it to do, that they're not going to mess around on, oh yeah, sorry, I skipped that, or the inverse?
It depends. It depends on the athlete and it depends on the person. So my best adherence comes from Orange Theory members who work out at 5 a.m.
Ooh, why do you think that is? 5 a.m.
Because they are always there at 5 a.m. They're consistent. They're type A. They have a plan. They know they have a schedule. So like they're very routine based. So if we just add in this rehab into their routine, it's done. It's going to happen. They're not going to miss it. If I have a college athlete who's just like willy-nilly like, oh, my shoulder hurts, and I'm like, okay, let's do these 3 exercises. 3 days later, if it doesn't feel better, they're like, that didn't work. Or 3 days later, if it does feel better, they're going to stop because it feels fine. And then it just keeps coming back. So it's like, it depends on the person and it depends on personality types. Like rehab isn't fun and like building it into a program isn't fun. But I do think athletes don't want to do extra work. They're already training a ton. And like, yeah, and ideally you would think like athletes probably love doing their rehab because they know it's going to get them better. But I think my athletes have worse adherence in some cases than my Orange Theory member patients.
Interesting. And especially that 5 a.m. Detail there too, because to be a consistent AM workout individual.
Which all my Orange Theory members have all of them have really great adherence to their exercises, but the 5 a.m. group in particular has this like different edge to them in a sense of like they're working out at 5 a.m. every single day. They have that routine. And if they need to add something in to make sure that they can keep doing their routine, they're going to do that.
Yeah, it's hard to do, especially in the summertime when the sun's out till 9:30. Well, I love it. So that's actually a good place to end it up. But wanted to ask both of you, any last thoughts, final words, final feelings on anything we've talked about today or anything we didn't talk about today?
I would love to know, being a chiropractor, do you also find yourself getting caught down the rabbit hole that is chiropractic videos of just the crack and whack, like montages on YouTube? Because I certainly find myself sometimes going down. I've watched 5 to 10 minutes consistently of just satisfying chiropractic adjustments.
And if not, what rabbit holes do you get caught up on YouTube?
I don't like watching chiropractic videos.
What, even I've seen them do it on animals, like a giraffe. They're like doing a little crack and whack on a giraffe's neck. Yeah. It's gonna be a thing.
Yeah, I can't get down that rabbit hole. I got down the rabbit hole of that Norwegian Olympian who loves his chocolate muffins. Have you seen that?
No.
I saw some post about it, but I didn't look that far into it.
I got down the Clinton Kane and Brooke rabbit hole of all the drama with him gaslighting her. If you haven't seen that, I would go on TikTok and look.
Ooh.
That was wild.
What was this?
It was like a 25-part series, and she and him dated, and he was like gaslighting, and he's kind of a narcissist, which, this is my opinion. He's going to say I'm wrong if he listens to this. He'll probably make a video against me, but she went through all the receipts and was like, this is what he did on this date. And he came through and made his own set of videos and was like, no, actually, you said we got pulled over before we went to Tahoe. We got pulled over on the way home. And we're like, the whole point was that you used a fake ID and like you lied to her about your age. And like, it's all this back and forth.
Wait, who are these people?
I don't know. His name is Clinton Kane. I guess he's a singer. I'd never heard of him before this. Her name is Brooke. I don't know her last name.
So this is not the Norwegian guy.
No, but the Norwegian guy.
Okay, I thought you the muffin
No.
dude.
I was like,
The muffin man?
No, those are my two. Those are my
rabbit holes,
two
okay.
rabbit holes that I've gotten down recently.
Okay.
This Norwegian Olympian, I don't even know what sport he does, but he loves the chocolate muffins at the Olympics in the dining hall. Those are my rabbit holes.
Okay. I love that.
Chocolate muffins.
That's a great place to end it. So everybody, thanks for listening to the Average Bros Gym podcast. Go and follow us on all platforms, which is like 4, YouTube, Spotify, Apple Podcasts. I don't know if you can follow people on Apple Podcasts, but listen to our show there. You can also send us an email at averagebrosgympodcast@gmail.com. You can sign up for our Patreon, and then you can also, I think that's it. I don't know. I tried to use X for a while /Twitter and just stopped because I don't really give a fuck anymore. I was like, we got 4 followers and they're all bots, and I was like, I don't think anybody uses this platform seriously anymore. Anyways,
Sorry, Elon.
yeah, I'm not sorry to Elon. Anyways, friends, thanks for listening to the Average Bros Gym podcast. Maggie, where can they find you?
You can find me at Dr. Maggie Koethe on Instagram. I think I'm just Maggie Koethe on TikTok. I don't know if I post on TikTok. Sometimes I do, but my Instagram is probably where you can find me.
All right, and you can also find your Nordic Rehab at Minnesota Movement in Excelsior, Minnesota.
Yeah, that's linked on the Instagram.
Hell yeah.
Anything you need to find is there.
Hell yeah, I bet it is. Go see Maggie for all of your needs. And then, yeah, appreciate y'all. Thanks for coming on, Maggie.
Thank you so much for having me. This was so much fun.
I'm so glad. And yeah, we'll see the rest of you very soon for another episode of this show. And we'll see you later. Wait, no, I don't want to do that. There we go.